Hello, I'm Gurjot, and welcome to our series, How to Live Over 100 Years of Healthy Life. This is India-centric podcast, and today we are kicking it off with a very special guest, Dr. Anil Vasali, to talk about diabetes. So, Dr. Saab, first of all, Dr. Saab and I, we know each other, and we are colleagues and friends.
Yes.
And why don't you tell people about yourself briefly?
Okay, I think you already told. So I am Dr. Bhansali. I was the former head at PGI Chandigarh, Department of Endocrinology. And I think the PGI has given me a lot of opportunity to learn about diabetes. And I am still learning at Gini, where we have joined hands with Gurjot. And I think I'm lucky to have a friends like Gurjot who are even an technocrat. He is basically an engineer and he has become more interested in diabetes. So the questions posed by him sometimes are more challenging. So I think I like that. I like that said these questions are really important, and I think the way in which we are working to help the people, I think that has to be appreciated, and I hope our conversation with Gurjot before you will definitely help you in making you to live for 100 years with a good quality of.
I think I should tell a little bit more. Dr. Saab is too humble to talk about himself. So Dr. Vasali, he's one of the best endocrinologists in the world, and who has been working at PGI over 34 years. And he has more than 630 research papers published. And, with a clinician of his caliber and a researcher, that is like a unique combination. And the number of patients he has seen is I think it's like out of this world, the number he has seen.
It was been like.
And yes, and very hundreds of thousands of people. It's like they get 1,000 people every day in their OPD.
But almost 3,000 patients a week. So roughly 10 to 12,000 patients a month for years together. So I think the number may exceed in lakh.
Yeah, so he's like.
So I think that's why the PGI is called the Temple of Healing.
So PGI is one of the premier postgraduate research and medical center, and he was at Chandigarh where we are today.
Yeah.
And other thing is outcomes that Dr. Vasali has got. Even us working together, that more than 92% people will
are with a hemoglobin A1C below 7%.
Yeah, so that's why we have Dr. Vasali, somebody I know and trust, to talk about diabetes and living longer. So, okay, so let's start.
So you talked about healthy life, or you talked about the long life.
Yes.
Here the long life means it also should be a healthy life.
Yes.
So it's a long and healthy life. That's, I think, very important. People will live longer, but their quality of the life may be very poor.
Right.
So it does not have a meaning, in fact. So they should be live long, but live healthy.
Yes.
Their quality of life should be maintained.
Yes.
So I think that's the aim. And that's the aim of the people. Even the God has created these people on earth. God has created so many creatures in the universe. But I think everyone has got a setup for their lifespan. The God is very intelligent in setting out that plan.
Yeah, Doctor. So I think with that, let's get into. I think you and I have talked about it. You have this view around Indian mythology that there is some deterministic view that how God has a plan for that. So let's tell people about what you.
So I think most of the people will believe or should believe in Indian mythology. And I think Indian mythology has got a background of thousands of years. So, and you would have definitely heard, सुना भी होगा आपने कि आदमी की उम्र और किसी भी प्राणी की उम्र उसकी सांसों पर, कि जितनी सांस है उतनी की उम्र है. तो इस तरह से यदि देखा जाए, if we see that, तो हाथी की जो उम्र है, it's around 70 years. It's one of the, I think, longest in animal kingdom, invertebrates. If you see tortoise, it has got a 400 years. And you see the respiratory rate of, breathing rate of tortoise is only 4 per minute. That's why this statement goes very true, is that आपका जितनी सांस है उतनी आपकी उम्र. तो सांस पे आप कंट्रोल रखिए तो अपनी उम्र बढ़ाइए.
Slow down your breathing.
तो मनुष्य अब मनुष्य का जो है तो उसकी उम्र का जो उल्लेख आता है कि इंडियन माइथोलॉजी में, वो करीब 120 से 130 वर्ष। और वन ऑफ द वेरी इंपॉर्टेंट टेस्टिमनी इज लॉर्ड कृष्ण, कि भगवान कृष्ण जो 5000 साल पहले हुए, महाभारत के जो कथाकार थे, तो उसमें भी देखा जाए तो कृष्ण भगवान भी 120 वर्ष थे। ये मतलब ये कहना चाहिए कि हमारा 5000 साल पुराने का जो टेस्टिमनी है उसमें भी भगवान श्री कृष्ण, तो कहने का तात्पर्य यह है कि आदमी की उम्र, यदि भगवान कृष्ण की उम्र कि जब उन्होंने मनुष्य का शरीर धारण किया तो मनुष्य की उम्र करीब 120 साल तो होनी चाहिए। और अभी भी हम देखें इस, इवन इफ यू सी इन दिस सेंचुरी, so many people will listen from Japan, many people will listen from America, and even some people from India. They do cross, they are more than 120 years old. So I hope and I believe this not only in Indian mythology, but the science is that you have gotten, if you see in the perspective of science, then you're regulating the number of breaths, one. So I think that regulates that has got an impact on your lifespan of the cell. So if we have got to really talk about it, to say what is life? Life is a functional cell. If we talk about life, it's a just functional cell. Cell should be functionally normal till you die. So this functionality can be maintained by the healthy life.
It's a self-functionality. I think let's say that we are, we all are cells and we have just maintained the self-function at a very biological view.
In a biology.
In biological view.
So I just try to, because you will say that some people may not believe in mythology. So I think here the mythology and science, they meet together. And we can say that in that perspectives, if the self-functionality can be maintained, and because the self-functionality is also determined by not your genes, it's very important, but by the many epigenetic factors. So if you maintain the good healthy cell functionality, you're likely to have a good healthy life.
And I think around mythology you were talking about, we also hear like there are many rishis, right? काफी rishis हैं जो कि 200-300 साल भी बोलते हैं जिए, and they almost sort of control their breathing rate in mythology. So is that then that means that a human limit just based on the sort of number of breaths you take?
Yeah. So I think as you quoted that many rishis, munis, and they were surviving for 100 years, 200 years. So
do you believe that's true? Do you think that's true?
I think it may not be 200 years, but I think the pranayam has got definitely impact on this. So if you breathe, like you say, a man usually breathes around 12 to 14 breaths per minute. And if you say if you take only 2 breaths per minute, so means you are sparing how many breaths? 10 breaths you are saving. So means you are almost, so one breath will be how much? 5 seconds. So tell me this, you are increase your lifespan by 50 seconds. So if you accumulate, so you will prolong the life.
Okay.
But you have so many instances in life when you breathe faster than what you need. Suppose you become sick. Like during the COVID, people, you were the fastest breathing. Those who had a COVID, they had a very bad time. So means they have already adjusted their quota.
So what is the view on this? Is it that, I think if we just take mythology or a religious view, that God has certain number of breaths for you, you slow down, that how many breaths you take and then you do that, or biologically what happens?
I think I think by saving this, suppose you save your breath, how this breath translates into life. I think that's your question, if I have understood well. So I think by saving because you are saving the energy expended by the cells. Because once you take a breath, the oxygen is consumed for the glucose production, ATP generation, or the cell events goes on like that. So I think it is not deprivation. You are not depriving the cell of oxygen. You are regulating the oxygen to the cell. So the cell functions are better. So I think if you see in that perspectives, so by regulating your breath, you are regulating the cell activity, cell functionality, possibly in a better way. And that's why you are able to prolong the life.
Okay, slow down your machine a little
Slow
bit, huh?
down the machine.
Okay. I think, okay, now let's get to the diabetes. There was a sort of a little bit a good start. I think one of the important things is, कि इंडिया में कितने लोगों को डायबिटीज़ है या हम इसको जो मेटाबॉलिक फंक्शन बोलते हैं, ठीक है, मैं आई वुड ऑल्सो लव यू टू एक्सप्लेन कि मेटाबॉलिक हेल्थ क्या है. और उसके बाद जो आपकी एक स्टडी आई है, आई थिंक दिस इज़ वन ऑफ द मोस्ट कॉम्प्रिहेंसिव स्टडीज़ which came this year, just around the survey of in India about people with diabetes, right? क्या नंबर है, कितना नंबर है, and we know that it is pretty big and high number, but you did it. I think you and the whole team, right?
Yeah.
A number of people involved, and we have the numbers for India now,
Yeah.
and they don't look that great. We know that, but we're gonna, despite of that or because of that, we have to tell people, कि कैसे उसको control करना है. Tell a little bit about that study first, right? So what are the numbers, what we have learned?
I think it was a very pointed question is that because we had so many surveys from our country and usually they were confined to South India. And that always showed that there is a high prevalence of a disease. I think Dr. Mohan and as a part of his team, where I was being the principal investigator for the 2 states, I had a pride in that because none of the investigator was for 2 states. So I was for Punjab as well as for Chandigarh. And the total number of the people screened out of 28 states and 5 union territories, something around 1.13 lakhs. So it was a huge number. And such a large study has never been contemplated in the history of any country. So that's why it's a matter of pride for our country that we have got some data. And why we need a data, at least we should know what is the gravity of the problem, what is the depth of the problem. And if we know the problem, then we can have its answers and we can have the solutions. So this study was eye-opening. It gives a challenge to the healthcare providers. It's a challenge to the government also. It's a challenge to the policymakers also. So this showed that China still continues to remain a diabetes capital of the world.
Okay.
We are second, but we have got now something around 11 crore people with diabetes. So that's a huge
Type 2 diabetes.
type. It's all type 2 diabetes above the age of 20 years. So that's a number and age both are very clearly because the survey is usually conducted above the people of
Right.
20 years of age. So this something has got 11 crore people and the estimated prevalence was something around 11%. So means every 8% or every 9%.
11.5.
So means roughly like every 8% is a diabetic.
So that's a big change, right? Last time we were talking about 10 and just 11.5%.
Last time 10 and this. Because when we had a data of 15 states, it was something around 7.8%. Now we have a data of 28 states and the prevalence has gone up to 11.
Yes.
Because some states in India are having a low prevalence, particularly your Jharkhand was only having a 4%.
Uttar Pradesh too.
Even UP too has also shown a low prevalence.
Yes, yes.
And even the Gujarat has also. But the rest of the states, they are doing pretty bad.
Yeah. I think if I remember, I think we have talked about that earlier, Himachal, right?
Yes.
Himachal, you have friends from Himachal. You always think, they are, you never see like many sort of obese Himachalis. And you think, they are pretty healthy, for metabolic health. And Himachal had more diabetes prevalence than Punjab.
So I think it was amazing. It was amazing finding in that Himachal. But I think, as I mentioned, that once the economy is open, so I think the more tourism, more fast food, and even in Himachal now you have more comfort than the hard work, because hardly you have a roads to move. So like in Shimla, we used to say hardly any find people on the Mall Road, and now the Mall Road is
You can
flooded.
find parking there now.
flooded.
And you can,
So I think that's a change which we see in last 10 to 15 years. And I think the another contributory factor which is picking up for the higher incidence, higher prevalence of the disease is pollution. I think the air pollution has taken his...
so air pollution impacts diabetes. So how does that work?
So air pollution has got a lot of pro-inflammatory cytokines.
Okay, can you tell people what these are?
People are now talking about that because now it is, you see, if you go in Delhi, you will always talk about AQI, air quality index. In Chandigarh, we usually don't talk much because Chandigarh is relatively cleaner.
Yeah.
But if you see that in Punjab, in Haryana, where the farmers burn their parali,
Yeah.
and that leaves a very, very poor air quality index.
Right.
So I think that people now attribute that the high pollution is, or increasing pollution is also contributory for diabetes. And air pollution is associated with the same because you got a low oxygen in the content. And when you got a low oxygen, you certainly breathe more frequently. Your cell is not getting a appropriate amount of or optimal amount of oxygen. So cell functionality is reduced. So
Okay.
it is impaired.
So it makes you more susceptible for certain.
More susceptible for a disease and cell repair.
And you also mentioned, I think, COVID as well, right? When I saw again.
Even the COVID, those who had a COVID or those who had even mild COVID also. So I think all these illnesses, even they may be of a very short lasting period, but they had a huge impact on the individual's life.
So just for people to understand, so we say जब COVID होता है, right? So there is like again this like changes in your body, right? That with this virus attack, or sometimes you also say
Direct
pro-inflammatory cytokine, ये जो attack है body के immune system पे, it's just a attack on the immune system. And after people have COVID, we have seen, I think, in sort of in our center as well, and you know that you have seen so many patients कि COVID के बाद diabetes हो गई, right? And similar thing is with pollution. You say the same thing can happen if you live in a polluted environment.
Yeah.
So they both are sort of similar, huh?
So if you live in a very, even if you see the data from Delhi, pre-diabetes is something around 65%.
Wow.
So this was the.
It's just Delhi because of pollution.
This was the data before even ICMR and DIAB study. And Delhi is the mother of pollution. Is a city which is
Yeah.
of pollution.
Yeah.
So I think I don't say this all goes to pollution, but something the pollution is also contributing.
It's a contributing factor. ठीक है. And now coming back to the study, so we have around 101 million or 10 crore people with diabetes.
Yeah.
Or 135 million, 13.5 crore people with pre-diabetes. Like we have 23.5 crore people with sort of pre-diabetes and diabetes.
Or dysglycemia. So we have what
That's like
around 25.
there are not many countries with that much population.
23 crores or 25 crores people with a dysglycemia.
Yeah.
So full-blown diabetes and pre-diabetes. And even still many remain undiagnosed.
Oh, it is still. There might be more.
There still may be more. So many remain undiagnosed. This is a sample size, of course, it's a very huge sample size. We can extrapolate the data for the whole population. But I think still, this large number of 25 crore, and as you rightly mentioned, many countries even may not be having a population of 25.
Yes.
So we make a really, it's not good, but we really make a large chunk of the people with diabetes over the globe.
And you were telling me other hypertension, like blood pressure, or other dyslipidemia, जो आप इसके बारे में बताइए, they're even worse.
They are more than that. So if we talk about the high blood pressure, it's something around, we have got a prevalence of 33%. So every third person is hypertensive.
Yes, so around more than 300 million people.
More than 300 million people with diabetes, with the hypertension.
Wow.
So every third person, and we say that the hypertension is the mother of diabetes. Both are linked together. Those people who are hypertensive, they are likely to develop diabetes in future, because the common offshoot is basically insulin resistance. So if you are obese, if your insulin is not able to act upon, you have insulin resistance, that produces a lot of vascular changes in your body, this high insulin levels, and that leads to hypertension. Eventually your beta cells or pancreas gets exhausted, you become diabetic. That's why we say hypertension is the mother of diabetes. So they flirt with each other. Of course, the common denominator is insulin resistance, and what the people can also view that, what is insulin resistance? Means it's a mainly basically, if you see in a people's perspective, it's obesity. If you are obese, you are very, very likely to be insulin resistant. you are producing more insulin, or we are producing insulin more than the undesirable amounts, or undesirable quantity. And that insulin is very detrimental for the vascular health.
A minute, I think if we just like explain to people
Yeah.
in a very simple way, you tell me from like layman to be understanding it.
Yeah.
Okay, we eat food. Food has carbohydrates, right?
Yeah.
Carbohydrate food. Our body converts that into glucose.
Yeah. Yeah.
And now blood carries the glucose that has to take to all the cells.
Yeah.
ठीक है? Cells पे लेके जाना है. Then our pancreas release insulin.
Insulin.
Insulin is like keys to the locks of your cells
Yeah.
to open it to deposit so that the blood can send the glucose in. And now when you say insulin resistance, then कभी तो enough insulin आती नहीं है pancreas से और कभी सही time पे नहीं release होती, right? And then with that, there is more blood glucose in the body, so that doesn't go into that, right? Is that a correct understanding? How would you like to say in that?
So I think you are partly told, in fact.
Okay.
So suppose you take carbohydrates, so you take your fat and protein.
ठीक है.
So for their metabolism, they lead to rise in glucose.
Right.
So the glucose in the circulation goes to the pancreas as well, because every organ is flooded with glucose.
Right.
So this glucose goes to the pancreas, it stimulates the beta cell, which is the basically cell secretes insulin.
Mm-hmm.
So insulin comes into circulation.
Mm-hmm.
And these beta cells have a very tremendous capacity, in fact, to overcome the rising glucose. So even if you take a heavy carb, say full of sweets, or only sweets, your sugar peaks up, it shoots up.
Mm-hmm.
But your beta cells are having a reasonably very good result. So they try to overcome. They produce insulin, they try to overcome, keep the glucose normal. But they keep the glucose normal at a high cost. And what cost you are paying? The cost is you are maintaining at a high insulin level. So you are requiring the more than the desirable level of insulin to control your blood glucose. But eventually every organ fails. If you beat a tired horse, eventually he will also die. So same thing is happening when you are flooding with the glucose, you are flooding with the glucose to the beta cell for years together.
Mm-hmm.
Then the beta cells, they eventually fail, and then you become diabetic. But I think the God is very kind, that the diabetes does not happen overnight, at least type 2 diabetes. It happens over years. It takes around 8 to 10 years to become a diabetic. It is never like that you slept comfortably in the night and you got up in the morning with diabetes. This can happen with type 1, but never with type 2. So God also gives a window period of around 8 to 10 years.
Is that also the period for reversal then?
That's why this window period is a great opportunity for reversal.
हम थोड़ा बता सकते diabetes reversal क्या है, and this is linked to very well with
So
it.
if you have a pre-diabetes or a stage 1 of the diabetes, then I think there is almost to 50% possibility of a reversal. And then even you will become a diabetic, because after there was a great change in that the beta cells, earlier it was always believed beta cells never regenerate. They die, and they do die permanently. But it is not true. It is not true. So even you can rejuvenate your beta cell by losing weight. So I think the more crux is basically going on your obesity and your fat cell mass. So if you reduce your weight, your diabetes gets reversed at any age. I think usually we say if your duration of diabetes is around 5 years, the possibility is much higher. But once you have become already, say, 20 years old diabetic, then the possibility is.
So I think the next big thing is कि diabetes आपकी होगी diagnose, तो हो सकता है कि आपको पहली बार हुई मान लीजिए diagnose, और 3 केस लेते हैं, आपकी आज हुई diagnose, आपको 5 साल से है या आपको 10 साल से है, तो उस केस में क्या रिवर्सल पॉसिबल है और रिवर्सल क्या है?
तो सवाल यह है कि आपको डायबिटीज़ आज पता चली है, आपको डायबिटीज़ 5 साल पुरानी है, और आपको डायबिटीज़ 10 साल
जी।
तो जितना ये जो मर्ज है, रोग है, जितना पुराना होगा उसकी रिवर्सिबिलिटी की पॉसिबिलिटी उतनी कम। यदि आप न्यूली डायग्नोज डायबिटीज़ हैं, ताज़ा डायबिटीज़ है आपका, आप मोटे हैं साथ, क्योंकि मोटे लोगों का पैंक्रियाज इज बिगर एज अपोज टू जो पतले लोग हैं उनका पैंक्रियाज, उनका जो बीटा सेल मास है, जो इंसुलिन बनाने वाला फैक्ट्री है, वो बड़ा है। तो पॉसिबिलिटी ऑफ रिवर्सल उनमें ज़्यादा है जो मोटे हैं और जो न्यूली डाइट।
That's such a sort of counterintuitive thing.
दैट विल हेल्प। और दूसरा एक ये कि आप प्रेडिक्ट भी कर सकते इवन ऑन डे 1 कि आपकी पॉसिबिलिटी रिवर्सल।
अगर आप थिन हैं, आपका वेट लूज करने वाला नहीं है ज़्यादा, फिर डायबिटीज़ तो रिवर्सल के चांस कम है।
इवन इन टाइप 2 डायबिटीज, सपोज you are a non-obese type person, then you may not have a good beta cell mass. Obesity से, जैसे मैंने पहले एक बार बताया कि ओबेसिटी होने की वजह से आपको जो पैंक्रियाज जो उस समय शुरू में काम करना पड़ा, उसकी वजह से पैंक्रियाज बिकम बिगर इन साइज इज मोर, एंड वंस यू शट डाउन द वेट द पैंक्रियाज आल्सो गोज डाउन। सो दैट लीड्स टू कि आपका पॉसिबिलिटी ज़्यादा। 5 साल का डायबिटीज़ है फिर भी पॉसिबिलिटी, यदि आप मोटे हैं तो काफ़ी अच्छा पॉसिबिलिटी है। इवन यू बिकॉज इवन एट जिनी वी हैव सीन सो मेनी पेशेंट्स इवन विद डायबिटीज ऑफ 5 years. Now initially we enrolled them only in an intensive program, but now we are finding that they are not requiring only 1 or 2 pills, and then they are still obese. Then we are asking them, you can also have a probability of reversal. जिनको 10 साल का है उनमें बहुत कम है some amount naturally. So as you grow older, the pancreas also become old, and the rate of oldness or olderness, the rate of olderness is faster if you are diabetic.
तो जो सारे क्लेम्स है कि कहीं लिखा हुआ है डायबिटीज रिवर्सल का पाउडर, डायबिटीज रिवर्सल का प्रोग्राम, तो बेसिकली ये डिपेंडेंट है आपकी कंडीशन पे। आपका
अरे आपने कई बार ये भी सुना है और शायद कि आपने इवन बेरेटिक सर्जरी कराया जिसमें यू कैन हैव ए वेट लॉस ऑफ 25 किलो 30 किलो, उसके बावजूद भी डायबिटीज रिवर्स नहीं होती। इट ऑल डिपेंड्स अपॉन कि आपके पैंक्रियाज में कितनी जान, आपका बीटा सेल जो मास है उसमें कितनी जान है। यदि उसमें जान है तब तो डायबिटीज रिवर्सल होने के पूरे चांस है। और फिर हम लोग ब्लड के टेस्ट द्वारा पता कर लेते हैं सी पेप्टाइड जिसको हम कहते हैं फास्टिंग सी पेप्टाइड, तो उसमें यदि जान है यदि मोर देन 1.2 यदि आता है तो हम उसको कहते हैं भाई आपके पैंक्रियाज में जान है डायबिटीज।
बेसिकली हम आई थिंक जो कैलकुलेटर हम काफ़ी लोगों को शेयर भी कर देंगे कि कैसे अपना देखना है कि आप रिवर्सल आपके लिए पॉसिबल है या नहीं है। तो अगर मान लीजिए भी आपको 10 साल की डायबिटीज़ है, रिवर्स नहीं हो सकती, 10 या 15 या 20 साल से है, और हम चाहते हैं कि आपको 100 साल से ऊपर तक अच्छी लाइफ जीनी चाहिए, तो क्या करना है और क्या हो सकता है डायबिटीज़ की वजह से जिसको हमें रोकना है?
एक तो ये यदि हमारे दिमाग में आए कि भाई अब तो मेरा 10 साल का डायबिटीज़ हो गया है, 15 साल का डायबिटीज़ हो गया है, अब मैं कंट्रोल भी करूँ तो उसका कोई ज़्यादा फ़ायदा नहीं होगा, ऐसा नहीं। यानी इफ़ यू कंट्रोल डायबिटीज़ एट एनी पॉइंट ऑफ टाइम इट इज़ रिवार्डिंग। यानी ये कंसेप्ट बिल्कुल दिमाग में रखें कि यदि आप अपना ब्लड प्रेशर, यदि आप शुगर को कंट्रोल, कोलेस्ट्रॉल को कंट्रोल, यदि गुर्दे से कोई प्रोटीन लीक हो रहे हैं उनको कंट्रोल, और ये सब पैरामीटर यदि आप, और वज़न का कंट्रोल, ये सब पैरामीटर यदि आप अपने ठीक रखते हो, so there is always a possibility of doing well, and your complications may not completely revert, but at least उनका जो प्रोग्रेशन है वो रुक जाए। तो इसलिए अब एक मैसेज जो सबको ये जाना चाहिए कि यदि आपको डायबिटीज़ आज पता चला तो योर कंट्रोल ऑफ डायबिटीज़ शुड बी वेरी इंटेंसिव फ्रॉम डे 1 इफ़ यू डू दैट।
यस,
उसका सबसे बड़ा फ़ायदा ये है कि उसमें दवाएं कम, मेहनत कम, it is easier to control and easier to maintain. If you start from day 1 on these exercises, that sugar को control, blood pressure control, cholesterol को control, from day 1 intensively, you require less number of pills,
right,
you require less efforts,
right,
and then you require less money also. Economically it is more viable. Your diabetes is a expensive disease.
आई थिंक इसके साथ एक
more viable.
बहुत ही इम्पॉर्टेंट पॉइंट है जो आई थिंक एवरीबडी शुड नो कि डायबिटीज़ ट्रीटमेंट के बारे में। सो आफ्टर यू नो डूइंग दिस फॉर अ वाइल एंड ऑफ कोर्स लर्निंग फ्रॉम यू, नाउ वी टेल एवरीबडी कि अगर आपको डायबिटीज़ है और आप डायबिटीज़ की ट्रीटमेंट कर रहे हैं, दवाई खा रहे हैं, और अगर आपका डायबिटीज़ कंट्रोल में नहीं है, दैट मीन्स इट्स नॉट बिलो 7, लेट मी टेक दैट, इफ इट्स नॉट बिलो 7, लेट्स बी 7%, चाहे आपका लाइफस्टाइल भी नहीं ठीक है, आप दवाई खा रहे हैं, then you are not on right treatment. And if you have been doing it, say that more than 6 weeks or 2 months, then you need to change your treatment. अगर आप दवाई खा रहे हैं, you are on the right treatment, it should be in control. Is that right?
I think it's very right, because even all guidelines, earlier there was no guideline to how frequently you should titrate the treatment.
Right.
Now very clearly said that in every 3 months you do a hemoglobin A1C, and if you are not able to achieve below 7, it requires change in your treatment. This is, I don't say regardless of lifestyle modification. Well, lifestyle modification always accompany the medical treatment. It should go ahead. But suppose someone is not able to lose weight despite of so much of efforts, because the life is not always uniform. You have so many things which does not allow you to change your lifestyle. Like you say, even I say the weather in India is not conducive to do even a regular walk 12 months a year. Sometimes you got a very heavy rain, no walk. Sometimes you got a very harsh winter, you don't have a harsh summer, you got a very chill winter, you can't do that. So weather is also sometimes not conducive. Sometimes family conditions may. So if you really talk in a real world, the lifestyle program is a part of the medical treatment program, but it is difficult to enact, possibly because of limitations. So it's a responsibility of the physicians that even on medications, by modifying them, by changing the new class of drugs, or by choosing the approach, hiking the doses, they should try to achieve hemoglobin A1C below 7.
Right. क्योंकि इसमें दो बड़े जो पॉइंट्स हैं जो बिलीव्स के रिलेटेड, कि एक तो है कि दवाइयाँ लगातार बढ़ती रहती हैं, दैट्स नॉट द राइट बिलीफ एज वेल, क्योंकि वो अगर आप शुरू में सही ट्रीटमेंट में नहीं हैं तो बढ़ती रहती हैं, अगर आप शुरू में इंटेंसिव करते हैं तो वो कम होती रहती। तो एक वो
शुरू में आपने यदि डे 1 से आपको डायबिटीज पता चला, तब से आपने यदि कंट्रोल करना शुरू किया, यू रिक्वायर लेस नंबर ऑफ पिल्स एंड लेस changes in your dose schedule.
Right.
But if you start do these things late, you may require this, and you require more number of pills as the duration of diabetes increases.
Right.
It is mainly because your beta cell, it progressively goes down. Your pancreas functions progressively goes down.
Bill.
But if you control very well, even the rate of decline in beta cell function becomes slow.
Bilkul.
So I think the message which we should give that intensive control from day 1, intensive control at any point of time. If there are no comorbidities, you can do that. Even this helps in preventing the progression of diabetic complications. Because the patient does not die of diabetes. They die of its complications.
Yes, that's
so complications are very, very important. And people believe that, or people use earlier, even scientists also used to believe that diabetes affects only certain organs, like your heart, your kidney, your nerves, and your eyes. But it affects every organ of the body. It knows even the brain. Because people used to say earlier dementia, the Alzheimer's disease, which is very commonly emerging in people with diabetes, it's the outcome of high blood sugar. Similarly, fatty liver disease, which has become it is an outcome of the uncontrolled diabetes or more carb intake. So you can see that every organ is affected by the diabetes. But I think the good point is that if you control everything, then every organ can be protected. Or rather, in our study, what we have shown even in PGI and what we are seeing at Gini is that in Gini follow-up is only of 2 years. But those who are regularly following with us, they are doing much better as opposed to those who visit infrequently. If you visit frequently, you do much better.
Right.
Because your things are picked up. And then you are treated accordingly. If you don't visit, you lose.
I think it's very important data, that 2 data points, like so that people can live over 100 years. So one thing is, I think you usually say that people who have diabetes, who are on right treatment and visit, I think their physician, like certain
At least 3 to 4 times a year.
is
good enough.
They live longer than people without diabetes.
That is mainly because you are picked up by so many things. Suppose you come today and I get checkup done, and then hypertension, suppose you find your blood pressure is not controlled. Your medicines will be hiked and you will be asked for a more lifestyle program. Your sugar is not controlled, you will do more changes in that. Suppose you have a leakage of proteins from the kidney, you will do that. So I think these things are picked up and you are targeted for these things, and then eventually this results in, so they live longer. In fact, you can live longer if you if you can keep the disease in control. And diabetes control is not only glucose. Remember, blood pressure, cholesterol, weight, urinary protein, and lipids. All has to be controlled in total. So it's a comprehensive control. So if you control diabetes, I think you can control so many things in your body.
So you need a holistic approach.
You need a holistic and you need a very pragmatic approach for the control of a disease.
And again, I think we touched reversal, but reversal ke baare mein ek aur cheez. Reversal means that your blood glucose is in control, which we say that it should be below 7 at least, or can be below 6.5% as well. And you should have made changes to your lifestyle in such a way that you can maintain that level without medicine.
Yeah.
So जो एक usual question होता है कि we don't want to have medicine. That's the only time you shouldn't have medicine is then when you have achieved the reversal. Otherwise, you always need medicine to control it, to avoid complications.
Yeah. So, and one more point is that many people, even at presentation, so newly diagnosed diabetes, they say we don't want to take medicine, we will do the tight lifestyle modification program. Good, you do that. But I think you also learn that how long you can have such rigorous control, which is usually out of reach. You can do 1 month, 2 months, 3 months. Once you even achieve normal, after that you become relaxed. Again, it shows up. So my submission is that even you are newly diagnosed type 2 diabetes, even you are highly excited to do the intensive lifestyle program, take the medications plus lifestyle program. If you go together, you are able to sustain well for a long time. If you do only lifestyle and depending exclusively on that, after some time you get relaxed and you lose the control. And the second point is that if once you achieve a remission and maintaining your hemoglobin A1C without 6.5, it's very clear it's without medications. You can continue. Lifestyle modification is to be continued because it is a part of the healthy life.
I see.
It is not a part of a diabetes. You have to have a lifestyle modification program.
Yes.
For to live healthy and to live long.
For your cells, I think functions, and so that you have more cells.
If you
we will cover that in detail in one.
Yes.
And I think probably today we will be short of time not to cover. We'll also cover using metformin, or we should use or not use metformin for longevity.
Yeah.
That we'll cover in other day. But today we just focus on diabetes. So diabetes complications, I think these are the main things.
So
that
every organ, I think the principle is that every organ, the glucose is, I think, the most notorious for involving every organ.
So what tests would you recommend for somebody to do every year if they have diabetes?
Okay. So annual screening program is there. So where you have to do a hemoglobin A1C once in 3 months. If you're achieving below 6.5, then you can do once in 6 months. So 2 consecutive HbA1c below 6.5, then you can do once in 6 months.
If not, then every 3 months?
If not, every 3 months.
So basically go with every 3 months?
Every 3 months you
HbA1c.
do a hemoglobin A1c.
Okay.
The urinary albumin creatinine ratio, which we also recommend, is that once in a year. But if you're leaking urine protein in the urine, then you have to do every 3 monthly till it is normalized or till it becomes controllable.
So what is abnormal should be checked every 3 months?
So that's more than urinary albumin.
I think others is every 3 months is abnormal. Check every 3
Then
months.
you have to do lipids.
Okay.
So lipids, you start the treatment and then
Lipids are like heart related.
once in 3 months, and once they are normalized, once your targets are achieved, then you can do once in 6 months.
Right.
Then your hemoglobin, then your blood pressure. The blood pressure should be checked at every visit. That's every 3 monthly. And if it is not controlled, then you should be putting more weight on that. Then weight. You should closely, because the guideline says that you should try to maintain your ideal body weight. So that's very important. And now all strategies are basically on a weight reducing therapies.
Right.
Your semaglutide, your liraglutide, or tirzepatide. So many new drugs are coming. They all focus on weight. So now the weight should be try to achieve either 10% of the body weight what you have, or you try to achieve the ideal body weight. And then some people talk about uric acid. If it is high, you should also try to work.
I think mostly blood
So I
tests
think
you do.
I think all metabolic parameters and your body parameter, and also on a waist circumference, because some people may be
Yes.
having a BMI in a normal range,
Right.
but still they may be having an abdominal obesity, which should also be taken.
Should I do ultrasound once a year or no?
Yes, you, because the new guideline and a foot examination. I forgot just the foot examination, and a doctor must examine the foot, see the shoe.
Do you say ABI, VPT?
Yeah, ABI, VPT should
So
be
these
done, and clinical exam. Every patient should be examined for foot, and then you can repeat VPT or ABI once in a year. And besides
Fundus.
the foot examination, fundus.
Right.
And preferably at one time in a year should be examined by the eye ophthalmologist, and particularly with the dilated pupil. You can see the fundus. A physician can also see the fundus without that, but they should see with the dilated pupil.
So basically, all things that can go wrong, you check once a year. Your eyes,
Eyes once a year.
your
Foot is also
your
a year.
foot,
Your kidney should
kidney,
be at least once a year.
Your
But
nerve
it is
health.
normal that you require more frequent. Lipid at least once in a 3 months. Once it becomes stable, you can do once in a 6 months. Hemoglobin A1C once in 3 months, and blood pressure at every visit.
right?
So I think these things must be examined, and if you all these parameters in a normal range, so I think what can prevent not to live for more than 100 years?
Yes.
Nothing.
Nothing. All right. Thank you very much, Dr. Masai.
Thank you.
Thank
Thank
you
you,
so much.
Guru, for
Okay. Thanks.
for nice
So we
conversation with you. I hope
We'll continue this.
I hope the audience would have really enjoyed.
Yes, definitely. Thank you.